All right. Well, hello everybody, and thank you for joining us today. My name is Michael Clifton. I'm one of the co-chairs on Patient Care Coordination Committee, and this is our, oh, sorry, was there somebody in there? Or?
Yeah, this is Scott Hadley.
Okay. All right, well, welcome. And this is the 2019 domain update for Patient Care Coordination. So we'll go ahead and jump into our agenda for today. There we go. So PCC, we're going to go over our PCC Vision and Mission, the strategic goals of PCC, PCC profiles and technical frameworks that were updated and worked on within this last year, as well as general committee updates and how to get involved, and then a Q&A to wrap things up. All right, so the learning objectives for today are to explain the vision and mission and the strategic goals of PCC, describe the work accomplished by PCC over the last year, provide updates on the general status of PCC and changes to our work cycle, and then identify opportunities for you to be involved in PCC activities and how to get more engaged with the IHE community. All right, so our PCC vision and mission is to continually improve patient outcomes through the use of technology connecting across healthcare disciplines and care paths. And our mission is to develop and maintain interoperability profiles to support coordination of care for patients where that care crosses providers, patient conditions, and health concerns or time. Moving on to our scope. So we have a large scope. We cover all the general clinical care aspects, so clinician perspective, patient perspective, coordination with other domains, and order processing. And we have a few areas that we focus on workflow and integration, being document exchange, clinical message exchange, and clinical reconciliation. So our strategic goals, to develop content, coordinate with external standards development organizations to develop and promote the use of content templates, develop new strategies to support multi-level content template guidance to benefit the global community. We also develop workflows, developing new profiles to reach outward to other IHE domains to coordinate workflow across care paths, developing white papers to, or by researching new areas that could benefit from standards-based interoperability guidance, and we support the nursing community by exploring and understanding the benefits that IHE profile work can have for the nursing community with partnering with nursing organizations and initiatives, and we develop profiles and white papers to support those initiatives as well. So we have a fairly large international presence. As you can see here, we're spread across Europe and North America. We have also been implemented in Asia and the Middle East. And you can see some additional information if you are interested in checking out our work in those areas under the additional information column here. And then we'll get into our updated profiles and the work that we've been doing this past year. Before we get too deep into this, are there any questions on the vision and mission? All right. So we'll move on to our profiles. So the first profile that we've been working on is our dynamic care planning profile with the focus on FHIR. So we've been working specifically to update DCP to integrate care teams work. So you can see we've been discovering care plan definitions, creating and updating the care plan definitions, listing care plan definitions, discovering care plan and care teams, creating and updating care plans and care teams, and listing care plans and care teams. A lot of this work has been to also update the existing DCP profile to FHIR R4 from FHIR R3. Some of the details on this work. So we've been providing the structures and transactions for the care plan definition. We've been working on getting the care plans and care teams and care plan definitions dynamically updated so that the patients can interact with the healthcare system. We've also been enabling provider access to create and update care plan definitions as needed. And you can see that we've been doing all of this work in HL7 FHIR using the plan definition and activity definition and subscription resources, as well as the care team and care plan. So here are some of our DCP actors and transactions. We have our care plan contributor and care team contributors that work alongside the care plan definition service and care plan or in-care team service and the care plan service to kind of complete this workflow. Another one of our profiles that we've been heavily working on this year is the CDA Document Summary Sections. This was a profile that we actually worked on last year and have been updating this year with a new component. Specifically, the update has been to add a new care team section with structured entries. This is work that we've been doing sort of in tandem with HL7, the examples task force within HL7, to develop a additional content profile that will enable the sending of care team information in CDA documents. Currently, there was only a CDA or CCDA care team narrative section that had been defined, and so this is expanding on that work to improve the ability to exchange this information discreetly. So a bit more of that, the detail on that information. So as you can see, we previously were able to render and show the sections summarizing information defined by the user. That was something that we had been doing with this profile and working on over the past year. And now we are enabling the ability to send care team information alongside the existing summary sections that we had worked on in the previous year. So quickly, little detail of the CDA-DSS actors and transactions. Then one of the new profiles that we've been working on this year as part of our off-cycle, or not off-cycle, but continuous cycle development process is the assessment, curation, and data collection profile. So this profile supports the selection of assessment instruments from a repository and the integration of those instruments into a provider workflow for the capture of assessment data for a given patient. This profile has been in development, but is currently sitting just before public comment, and we will go into some of the details as to how that will progress in just a little bit when we discuss some of the changes to our PCC work cycle. At our most recent face-to-face, we also had the International Patient Summary make an appearance as a potential profile. We will be discussing this more in the coming weeks, but this profile will be developed in order to assist the work that's been done in the IPS space by other standards development organizations in an attempt to really define a good place for IPS and a good testing framework for the existing IPS work that has been done by other standards development organizations. Currently, we are sitting just before having fully accepted this profile as a work item, but it will be presented to us as a detailed proposal in the near future. All right, so general committee updates. Before we move on to that, are there any questions about any of the profiles that we discussed? Okay, hearing none, we'll move on to our general committee updates. So one of the biggest things that we've done in the last year to update our current administrative kind of aspect of how we run the committee is we've been moving to a continuous development cycle. This is something that we've been doing alongside ITI, or the IT Infrastructure Committee, for a few reasons. Primarily that we are able to be a little bit more flexible with the items that we're pulling in to work on throughout the course of the year. We have had a couple of areas or a couple of periods where we've been a little bit light on workload and have the potential to do a little bit more. And so we are using this as an opportunity to take on new items as they become available, as opposed to having to wait for a specific time during the year. This doesn't necessarily change anything about the actual development process. We still go through everything from profile proposal review to acceptance, volume 1, volume 2 approval, go through public comment, and then eventually to publication. So none of that is actually different, but we are able to do that at different times throughout the year. One of the things that this is also going to assist with is potentially getting things out more quickly if they can be accelerated on faster timelines. So for example, if you did happen to have a profile that was fairly simple, or maybe even just a white paper that you could work on and have realistically approved and then ready for public comment almost within the same face-to-face period, it's something that we could potentially work on and be a little bit more flexible to now with this new development cycle. As stated previously, the ACDC profile was kind of our first foray into using this new continuous development cycle. We received the proposal for that back at, I believe, the February face-to-face and accepted it there and then continued development on it through May. Unfortunately, it did not make it into public comment. It was not sent out for public comment in this previous public comment cycle, but it would be able to be included in the next public comment cycle, potentially after the next face-to-face or as part of the time leading up to the next face-to-face, depending on when the work on that can continue. One thing to note is if a profile does not continue to progress during the course of two face-to-faces, that profile will be considered on the back burner or effectively abandoned until work begins on it again, and at that point we will require a new profile proposal in order to retake up work on that proposal. So I'll go ahead and pause here. Are there any questions about the development cycle, as this is one of the biggest changes that we've made to the committee in the recent past? Okay, hearing none, we can continue on. So just a brief review of the actual profile development process. So we start with our call for proposals, which as part of our new continuous development cycle is rolling and will happen prior to each face-to-face. More details can be found on the wiki that were defined or that was included on the last slide. Then once we go once a proposal has been submitted, the profile selection begins by the committee. If a profile has been deemed appropriate and that we would like to take up work on it, then we move into the actual development phase. At that point, we begin development on the actual profile, publish the profile for public comment, and then post-trial implementation after every comment has been resolved. Then that moves into connectathon testing. So this is where we can actually test against the profile and make sure that the work that we're doing has met the needs of the industry. And then it is published into the IHE product registry. And then we can demonstrate that at the HIMSS interoperability showcase. And once that's done, it will be installed along with all of the other profiles that have been developed into clinical products worldwide. And then that helps to improve the safety, quality, and efficiency in clinical settings for all of our users. Then, of course, we'll take what we learned from previous profiles and hopefully produce additional proposals that will continue to improve interoperability in the industry. So how can you get involved? So the first step is to become an IHE International member. So the details on how to do that are listed here. If you go to the ihe.net/join website, you can get more information and figure out if it is right for you. If you are not able to join the IHE membership, then you can still comment on the profiles as they are developed and kind of participate in things in that way. If you do have a profile that you would be interested in proposing to PCC, you may also do that, or you may do that if you are a member. So we have, as I was mentioning, the continuous development cycle for PCC now. The profile process is defined on this wiki that you can see here. We have a few helpful hints as well as some templates that can be used to submit a proposal. The call for proposals will happen on our Google Groups, which will be linked out in a subsequent slide. But that would be if you do have any proposals that you would like to present to the PCC committee, the information on how to get started is on that wiki. And if you know of any issues that are present in existing profiles or things that you would like to have clarified that potentially might be confusing to implementers, we also have our change proposal process. So if you are reviewing any PCC proposals or profiles, then please do keep in mind that you have the option to, or ability to submit change proposals, and you can visit the wiki linked here to get more information about that process and begin that process as well. So here are a few of so we have two different subcommittees essentially within the PCC committee. There's planning and technical, and so here are some of the planning committee responsibilities. They develop and maintain the strategy and the roadmap, as well as attempt at recruiting new members and help to educate the community at large about the PCC activities and our profiles. We currently are operating effectively in a collapsed committee structure where our planning and technical co-chairs are pretty much just a general PCC co-chair. But if you are interested in getting involved and may not necessarily be interested in the technical aspects of the committee just yet, then you can definitely get involved in the planning side of the responsibilities. If you are interested, please submit a comment or an email to the PCC Plan Google Groups to let us know of your interest, and we can assist you in the process of getting more involved and potentially being onboarded as a co-chair. So in addition to the planning committee, we also have our technical committee with their own responsibilities. So they focus primarily on the development of the IHE profiles and the maintenance of the profiles and the technical framework, and also recruiting new members as well. We do have a separate Google group for this committee, or this aspect of the committee. It's the pcctech@googlegroups.com. Again, if you are interested in participating, if you have any profiles that you would like to, or profile ideas that you would like to potentially workshop, please go ahead and submit them to the pcctech@googlegroups.com, and we can discuss things there and potentially find ways that you can get more involved. And just to kind of round out the leadership of our committee, we currently have 3 co-chairs. Again, as I mentioned, we're effectively collapsed into a single committee for the purposes of planning and technical work at the moment. And our 3 co-chairs are myself, Michael Clifton, Thierry Dart from ACIP, and Emma Jones of Allscripts. If you are interested in learning more about the committee, you can reach out to any of us, and we will be happy to provide you with any information that you need about the committee. And finally, we have a link and resource slide here. So we have a couple of important links that you might be interested in. We have our IHE.net domain website, as well as where all of these webinars are posted if you're interested in finding some of our past webinars and delving into the work that we've done in the past, as well as all of the other IHE committees can be found there. There is a newsletter website, as well as our general PCC committee email. If you have any general questions or requests, you can email the IHE@pcc.net email, and that will provide us with all of the, or get us the details, or send that to all of the co-chairs, as well as some of the other leadership on the committee. Then we also have our Google groups. They do require a membership, but that's pretty much just requesting the, if you request and are a member, then you will be given access to that. And you also have your application for membership link, as well as a link to our technical frameworks, our profiles, and registration for Connectathon. That link will bring you to both, or to the general Connectathon website that has links out to both the North American and European Connectathons, if you are interested in participating in either of those. And finally, we have our questions. Are there any questions from the audience?
Hey, Michael, this is Scott from, I'm from IHE, the radiation oncology domain.
Oh, hi, Scott.
This is a great overview, and I'm curious, how many clinical users do you have participating in this domain?
So we are currently a little bit slim on clinical users specifically. However, Emma Jones, one of our co-chairs, does have a nursing background. So Emma, I don't know if you want to discuss any of that. Okay, so but yeah, so we do have some clinical experience currently on the committee, although we're always looking to have additional clinical experience come and assist us in this profile development.
Hello,
so that is,
can you hear me?
yes, now I can hear you, Emma. Yeah.
I'm sorry, my mic went off there for a minute. So I heard a question. Hi, Scott. My name is Emma. I'm a registered nurse by clinical background.
Mm-hmm.
I also do a lot of work in the HL7 patient care working group, and this PCC committee works closely with the patient care working group. So a lot of some of the clinical workflow work that is described or developed on the HL7 side is actually brought over to PCC and become some of the use cases in PCC. And the dynamic care planning profile is an example of that, as well as the reconciliation profile and other workflow profiles that are in PCC.
Okay. That's interesting. I know in our IHE, we're always trying to get clinical users to participate, and we're somewhat successful, but it's always a challenge to draw them into the actual profile development. So.
Yeah, what we've found out is that a lot of the clinicians who are interested in standards development tend to be the same group of people across IHE, PCC, and patient care.
Mm-hmm.
And with patient care, so we reuse the clinical workflow ideas and try to solve clinical problems, and then we bring the use case over to PCC and develop it in PCC.
Yeah, that sounds good. Yeah. Thanks.
You're welcome.
Okay, are there any other questions? Okay, hearing none, I think we may be able to wrap up a bit early for everyone. All right, well, thank you all for taking the time to attend our webinar, and I hope that you were able to get some good information out of it, and thank you for the question, and have a great rest of your day.
Thank you.
All right.
Thank you.